Correct, yes. All right, are you ready, Chris?
Good morning, everyone. It is March 20th, 2020, and we are having a special Wright County Board of Commissioners meeting. We will begin our meeting with the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
We did not hear you, Charlie.
All right. Thank you, and we do have 4 commissioners present, and our 5th commissioner is with us remotely. We also have a couple other people that are with us remotely, and we have department heads here. So thank you for everyone, their concerns. We do have one thing, I believe, Administrator Kelly, to add to our agenda for today.
Yes, that is correct. We have received notification that we have been awarded, if you will, a COVID-19 response grant. Wanted to make sure that we could authorize board signature on that to receive that as soon as possible.
I'll make a motion to add that to the agenda for today.
Okay, motion made by Commissioner Delyden.
I'll second that.
Seconded by Commissioner Vetch.
Just a reminder, because we do have one via phone, we will have to vote everything voice vote.
Thank you for the reminder. So,
Roll call,
roll
yes.
call vote, yeah. So, Commissioner Potter.
Aye.
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 Commissioner Pearl.
Aye.
Right. We heard your aye. Thank you. Thank you. Just a couple to sort of recap the last few days for the public. The COVID-19 pandemic has definitely impacted most people around the world. It's disruptive and distressing to large numbers of people. The United States has taken bold steps to flatten the curve to slow the spread of the virus. In Minnesota, the state, counties, and local jurisdictions have joined in the efforts. At our Tuesday, March 17th board meeting, we declared a state of emergency in Wright County. Wednesday, we had a committee of the whole to review the continuity of operations plan, COOP plan, and determine that it was prudent for the health and safety of our employees to release as many staff home to work as possible. Yesterday, we had a committee of the whole to review our COOP, and also we'll be acting on those minutes shortly. We'll go over those. And just, I would like to thank everyone in our county. I'm grateful that we have such a robust public health and emergency management systems and divisions. Been very, very, proactive, gathering the information, sharing that with us. Information is on the website, and also for our administrative departments, all of our department heads, managers, supervisors, staff. I'm just really impressed. And when we have these plans in place for a reason, hoping we'll never use them, but boy, when it's something like this happens, to rely on what we've got in place is really, really great, helpful. So with that, we will move to the minutes. Administrator Kelly, would you like to go through that for us?
Sure. As you mentioned, Madam Chair, we had a series of meetings this week regarding COVID-19. The meeting in question in the minutes here was the Committee of the Whole that was held yesterday. We had all 4 commissioners in person, Commissioner Burrell via telephone. This meeting also had a number of staff, which I won't read, but to kind of summarize, I had provided an update of the meeting, the COOP meeting that was had the day before, and some of the recommendations that were provided within that meeting. We've already implemented many of those things, such as closing the public counters at the government center, limiting employees that are working on site, as well as suspending non-essential out-of-state travel. We're also working on social distancing with 6 feet between people in the meetings, and trying to get as many working remotely as possible to be out of the workplace. So the COOP plan states that the county policy is to pay employees whether they are working at home or at a county facility. The recommendation I made is to have the public areas closed until April 1st, or perhaps the 3rd. I guess we can discuss that, which would be the end of the next pay period, April 3rd. As you know, this is developing rapidly and continues to evolve. So we had discussions regarding the logistics of board meetings and various legislative items that are going on. If I skip ahead a bit, just in summary, we talked a little bit again about limiting public facilities and our plan to continue to do so for the upcoming weeks. We tasked department heads to look at long-term plans and determine employee workloads. We then proposed holding a county board meeting. It will be held on Tuesday, next Tuesday as planned on the 24th. And we have added a committee of the whole meeting on Thursday, the 26th, to discuss expectations for the following week. One of the other action items out of this meeting is we were tasking department heads to pull together estimates regarding how many employees might not be able to return to work because of either a family or a personal health issue. I think I'll work through that. Summarizing, if that's okay.
Yes.
So we talked a bit about two folks working and working from home and how the logistics of that will work. We noticed that we recently received information of some federal developments. There's an act going through called the Family First Coronavirus Response Act, and get more information up on that. There's some embedded impacts to leaves that are available for employees in sick situations, so we're continuing to monitor that. As was discussed at previous meetings, the Virtual Private Networks, VPN, has been deployed to numerous spots within the employees. We've added that to a number of PCs in order to allow working remotely. The county, it's noted, has access to LinkedIn Learning, which is online training, and we're working on a list of sessions that folks could choose to do during this time as well. So we're looking at potentially IT staff, if need be, could relocate PCs, monitors, and other equipment in the future. We discussed the Health and Human Services Board. That was planned to be on Monday. We've now moved those items on that meeting over to the 24th. We talked about after-hours meetings at the County Government Center and have mostly those have been canceled. The discussion and the decision there was to lock the facility front doors at 5 p.m. We had discussion about the Planning Commission, Board of Adjustment. We've canceled those for the immediate future. County Assessor spoke to the ramifications of our valuation notices coming out in the next week and the need. We're hoping to get some more information from the Department of Revenue regarding the individual districts and holding their meetings there. So was noted, Commissioner Burrell stated that we need to continue to provide service, and we talked a little bit about unemployment benefits available to state. However, right now I noted that is very they're getting overwhelmed. They're getting a number of calls, much greater than they had anticipated. And this time, we're continuing to have staff work, either here, but preferably remotely, and compensating them for their time as if they were all here and working normally. So, recommendations out of that meeting: extend the current employee compensation plan to April 3rd, 2020, which allows employees to work from home. Department heads will provide an estimate of the number of employees who will not physically be able to return to work after 4/3/20 due to impacts of COVID-19. We've moved the 3/23 Health and Human Services consent agenda items to the March 24th County Board agenda. Schedule a committee of the whole regarding COVID-19 strategies on 3/26 at 10 a.m. And lastly, get an assessment of how many employees may have no access to internet computer at home. So a bit of a summary and the recommendations of yesterday's meeting.
All right.
Madam Chair, I'll make a motion to approve the minutes and the recommendations from the Committee of the Whole on March 19th, yesterday.
Motion made by Commissioner Vetch. Is there a second? Second by Commissioner Potter. Commissioner Burrell, are you able to hear all the recommendations?
Madam Commissioner, suggestion. Bob had said the end of the pay period, which is actually Saturday, April 4th.
Good point.
I want to just modify that date.
Because
All right.
public health workers,
Thank you.
Several departments work on Saturday.
All right, so,
deputies, yeah.
Yeah.
Madam
Is
Chair,
that-
I will make that amended to April 4th.
Agreed.
Yep.
all right. Commissioner Burrell? We lose him?
They said that the audio is possibly not working, or that's.
No, the video was not working when it came on. I don't know. The gremlin ran away.
Is he
I
on
mean, I didn't touch the mute button, so. Commissioner Burrell?
It sounded like somebody dropped off on the ground.
All right. 5 seconds.
Madam Chair,
Oh,
Madam
okay.
Chair, I did hear you. I had my phone on a different screen, so
Okay.
I couldn't unmute my phone.
All right.
But yes, I heard everything.
Wonderful, okay.
Testing.
So, and you heard all the 5 recommendations?
I didn't touch the mute button. Commissioner Burrell?
Recommendations
All
and
right.
send it to them.
Madam Chair, can you hear me now?
Yes, we can hear you. There's something,
It's probably watching the live stream, I could only assume.
All right.
May have a bit of a delay to it.
yeah, there's a bit of a delay in response, but yes, we heard you. So we have a motion and a second to approve the minutes and the recommendation, and we're going to be taking a roll call vote.
I just sent him a picture of the recommendations, so.
Good, thank you.
We did mail him this,
That's wonderful.
email him this document prior to
So,
the meeting, so I don't
yes.
know if he's had a chance to review it, but
Okay, all right.
The only change,
The amendment was April 4th, not April
And-
3rd.
Yep,
That was the-
with the amended recommendation
Yep.
of April 4th. So roll call vote, Commissioner Vetch?
Aye.
Aye.
aye,
Aye.
Commissioner Burrell?
Aye. Aye.
Resolution, or, no, minutes and recommendations pass 5-0. All right. So, moving on, we have, Sarah, would you like to, or step up to the, since you got the. Thank you.
Pass that around.
Sarah Grotius, our Public Health Director.
Good morning, Commissioners. Yesterday, after the meeting, we received our first grant award, a letter for the amount of $147,695 to be attached to an existing grant fund that we get, which is a local public health grant that allows the state to push it out quick because they don't have to do up a contract because it already exists. I don't have anything, any guidance yet on what we can spend the money on, but we've been, as I think I've mentioned in the past, we've been tracking our time and expenses, and we've had that ongoing conversation with fiscal in our department, as well as I know that Christine has been connecting with Heather and other folks. And the performance period, just so you're aware, is from March 3rd to February 1st. I can tell you that this isn't going to be enough to make it to February 1st of 2021. But
we'll make it till April 1st.
well, one of the things that we have been asked to do by our local association that's advocating on behalf of us through AMC at the legislature is to start tracking if we could give them updates to our costs, which we haven't done that yet because we've been, just the way our system works, we kind of, until we had a vehicle to push that out to bill to, we've been kind of holding that time aside, but we're going to figure out if we can get a cost to see where we're at, and we'll give you that number at the next available time so that you know kind of where we're at. And drawing down, this comes in one lump sum. It's just, we don't even have to invoice for it. So I expect the sooner we get the stuff passed, the sooner that check will be here.
Yeah, well, it sure helps.
Madam Chair, I'll make a motion to accept the Public Health COVID-19 Response Grant awarded in the amount of $147,695.
Second.
Motion by Commissioner Vetch, seconded by Commissioner Delyden. Is there any discussion?
Madam Chair,
Commissioner Delyden?
I'm assuming we'll be able to use it for reimbursing the overtime and that sort of stuff, but will we also be able to use it possibly for anything we've had to purchase for helping out residents or that sort of stuff?
When did you get that? last night? Okay.
Christine, you want to
Because the last
step up to
email
the
that came
microphone?
wasn't, okay. What do you,
What do you-
yes.
Okay,
think
so
it's-
the
I
activities
can't see your
covered by the new funding, the establishment and operation
Oh,
of
yeah.
temporary sites, is this not
No,
helpful?
no, it's helpful,
Okay.
yep.
To provide testing services, to provide treatment beds, or to isolate or quarantine affected individuals. Temporary conversion of space for another purpose that will revert back to its original use. Staff overtime and hiring additional staff, staff training and orientation, purchasing consumable protective or treatment supplies and equipment to protect or treat staff, visitors, and patients, development and implementation of screening and testing procedures, patient outreach activities, additional emergency transportation of patients, temporary information technology and system costs to support patient triage, screening, and telemedicine activities, purchasing replacement parts or filters for medical equipment that are necessary for the equipment's operation, specialty cleaning supplies for facilities and equipment, expenses related to the isolation or quarantine of staff. These expenses must not include payment of wages for staff being isolated or quarantined. Do you want me to read that one again?
Yeah.
Because
You
it was
can,
kind of
but I
contradictory.
got it.
Expenses related to the isolation or quarantine of staff, but they must not include payments of wages for the staff being isolated.
So you could pay overtime to the other staff that you have to bring in.
Okay.
Other,
Pay for the wages of the ones that are out. Okay, that makes sense.
Yeah, so this pot of money goes to the hospital. There's a healthcare coalition that serves our area as well. We're part of a Central Region Healthcare Coalition that CentraCare is, kind of leads for us. So they also draw down and it's divided out. We haven't, since we've got this funding amount yesterday, I think I had quoted at least to Commissioner Vetch at one point in our EMAC FEP meeting that we were told to anticipate about $400,000. So I'm not, but there are so many different funding streams being passed, I'm not sure which one we're talking about.
Okay.
So, and we just haven't had time to dig into that, so.
Sure.
We'll get back to
Yeah, well, I mean, it really covers a lot, so that's good.
It does.
Did you
There-
say we'll be sharing this with the hospitals?
No, this is our portion, but they get a,
misunderstood.
but
They'll get some too,
they'll
then.
get some as well. That's why some of those, what I guess what I was thinking for more guidance is there'll be supplies that they allow us to purchase for supporting folks who are isolating, quarantining home. I think what I will tell you right now is that that's going to be a very few number of individuals because in order for us under current statute to call it isolation and quarantine, it has to be because they have a positive test. And we know that that's not happening. Yet we're committed to providing support to folks in the community that are self-quarantining or isolating because they have symptoms and can't get tested. And we are, diligently working kind of basically going through a process of who's on first, right? So if this client or this family already is connected with somebody in social services, they take first bat at making sure they have what they need. Same thing is being done for anybody that we see for home visiting if they are not connected to any other resource. We've had conversations with the schools, and we're still going through that list that they're connecting with their families that they know are at risk, some of our senior living facilities. So all of those networks are in place, and then what we get sent to us are either the resources they really can't find, or the folks that are really not connected to anybody that we don't want to fall through the cracks.
Good.
Okay.
Commissioner Potter, you had a comment or no? Okay. Commissioner Burrell, do you have any questions or comments before we take our vote?
Charlie, wake up.
Go ahead.
Do you have,
You know what I'm doing, just so you know, I was watching it on live stream, but there's a little bit of a delay, but I can hear real good on the live stream, but then I'm a little behind on that.
okay.
So.
I was just wondering if you had any comments or questions.
No, I think I'm just following along. I think
Okay.
what you're doing is good. I'll chime in if there's something
We'll take a roll call vote, and we'll start with you to vote.
I vote aye.
Okay?
Aye.
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 Thank you.
Motion passes 5-0. Thanks, Sarah, for all your extra time. I mean, it's been, exhaustive. This whole process has been exhaustive, and
No, I do have one additional question, because it sounded like we could quarantine public health or keep you all in one area. That was kind of the impression I got from her, from Christine. I'm just wondering how we can go about doing that.
They would like to be quarantined in Hawaii if you're going to quarantine.
Oh, you think so? Not Florida for spring break or anything?
Oh, God. No.
But if
I
you're
don't
in
want
a
to go on an
bunker-
airplane. Can you get me there?
yeah, right.
But if you're in a bunker, it doesn't matter what the outside looks like, right?
That's right.
We're all very healthy in that conference room, so
Yeah.
when somebody leaves, you're kind of like, okay, come back,
Yeah.
wash your hands.
And I think, I've noticed just increased awareness and precautions that the public is taking if you're going into stores and they're using something to open doors. And certainly retail businesses have, actually when one business in Buffalo, they close, now have limited hours, but they're closing early, and then they spend the next 2.5 hours sanitizing everything. So that's more efforts that are just being done. And the more people and businesses that do that, the better for everybody. Even, sadly, there's a lot of businesses that close that, they've just made that decision that protect everyone, and hopefully they won't lose too much, and we need to really get out and support those. And the other comment I guess I kind of thought about is that if there's people out there, our public, that don't hesitate to call. We're still open. We're open for business. We still are providing essential services. But there's also, if you kind of feel a little isolated, reach out, because we don't know all the people that are out there and how they're feeling about things. And I think it's important for all of us to be aware that there's people that need things, that maybe they don't have somebody to bring them groceries. So please reach out and we'll see what we can do.
Yeah, I would just like to share 2 stories. One is that with our 60-plus and healthy clients, we're calling all of them just to see, those are the people that we see in Foot Clinic.
Okay.
And most of them live independently, but they may have some other informal supports that they've, and some of them were people that they lived with, and they're very limited, or they're concerned about going out. And each of those phone calls takes about 30 minutes. It's not a short phone call to see how they're doing, because they themselves are feeling rather isolated. They use their time when Foot Clinic, it was uncommon to have 5 or 6 of the folks in the usually it's in like the lounge of where they live, hanging out, and the TV will be going, and they even bring snacks, and they can't even do that now, because we don't want them all close together like that, but then they are lonely, and so checking in with them. And so it's taken us a time to get to all the clients. And then the other piece is actually we're going to be trying to do some more outreach to promoting some more conversations, like what questions kids and young children have about the disease, and giving some perspective from like public health, and sharing that, because certainly you want to share with kids factual information. It helps them feel calm and ask them questions, but I know that they have all sorts of off-the-wall questions, and sometimes parents don't know the answers. So we're coming up with an innovative way to come up with that information and share it.
People have to get a little creative in some activities that they can do with their kids, and teenagers are bored, and we need to keep them, our social distancing and that kind of thing, but we need to keep them busy too, and active. But Commissioner Potter?
Yes, Madam Chair, you might suggest reading a book.
Yeah, that's true.
How about that?
Madam Chair, talking about innovative ways of reaching those. I had a niece with her kids that came out to the assisted living where my folks live. They have a window unit, and it was nice out the other day, and they're not allowed out. Nobody's allowed in, so from the window they were.
Oh, nice.
A little bit like Romeo and Juliet.
So the great grandkids, they're twin boys and a little girl, and they were singing.
Oh, nice. Yeah.
To grandma, or great grandma and grandpa.
Yeah,
So
that's a great
something
suggestion.
different.
Yeah, you can go up to somebody's window and talk to them, face to face if you can't. If you can't go in and visit them.
Next week will be warmer. I wouldn't recommend
Right.
doing it today.
Today
It's chilly.
today it's pretty cold.
My husband is hosting coffee hour in the cul-de-sac, and they all stand very far apart, but they bring their coffee out for their break, for all the people that are working at home. And yesterday, when I came home, my kids were having a battle with homemade, with each other, so it's fine. They live together, but we have homemade shields and swords, and so they're definitely 6 feet apart.
Right.
We cover them with pool noodles, so you can
Yeah.
get really creative.
So, yeah, well, thank you. Any other,
I have nothing
anyone else have
further.
anything? Chair?
Chair?
Yeah.
I didn't, well, it's just something that's occurred to me, and I'm not sure if the board's discussed it or not. You do have the ability, I know you have 2 meetings scheduled next week, you do have the ability to meet by telephonic means or other electronic means. You know, I look at this room and the number of people in the room, and I'm wondering whether it's unwise to continue holding in-person meetings. There are provisions for doing that. I don't know if the board's considered that or not. I know there's some other public bodies that have gone that direction.
And I appreciate that, and this is unusual for us to have this many people at our board meetings, certainly, but maybe if there's, going forward, we probably won't have the same need, or people can be watching, you know, if they're not on the agenda per se, just watching us from the, like Charlie is, so on the live stream. But yeah, definitely something.
I would, Madam Chair, I would recommend that you perhaps keep the telephonic option available then for department heads and the public. You know, the whole point is to try and make it interactive, and I guess I'm not a techie person, but I think if they're just watching on YouTube, of course,
Right, that's
you
true.
can't
They can't
interject
respond.
comments.
That's
And
true.
not that the public has a right to do that necessarily, but they have a right, I'm sure the department heads would like that option, and supervisors.
Yeah, thank you. And I guess we can have a consensus perhaps of offering that
Yeah.
going forward as certainly,
As an option, we'll see what it goes. I mean, if, depending on what happens at the state level, we may not end up having a choice.
right, that's true. But yes, so any department heads or members of the public that would like to participate in our meetings but not be physically here, please let us know, let administration know, and we can work with IT to give you the information to phone in. Thanks for
Madam Chair.
bringing that up. Yes, Charlie?
I was going to say that you can watch it on the video live streaming right now, but it is about 10 seconds behind, and that's what I was struggling with a little bit. So
Right.
on the phone, it's instantaneous, but there's about a 10-second delay on the video live stream.
Yep. Yeah, and if people have the ability to both, you know, phone in or be part of the meeting remotely, but they can also watch the live stream and knowing that there's about a 10-second delay.
Well, the other thing is too, instead of having multiple people from the same department, if we just had one person from each department, then you'd be able to maintain the required or suggested 100 feet apart from each other.
Or 6.
Oh, or 6.
All right. Any more comments from anybody? And thank you, also my fellow commissioners, for being so, keeping informed and engaged and caring about this whole process. Appreciate that, along with, as all the people I mentioned before, so. All right, if there's nothing else to come before the board, we are adjourned, 10:30. Thanks.
I didn't see before.